I am Morgan Vaughan. We are here at Facts at 5 on Tuesday, March 31st. I am here with Christine Sampson from the East Hampton Star. Thank you so much, Christine.
No problem, Morgan. Hi.
You were great yesterday, and you had so much great local information. I really appreciate that, because what we're trying to do with Facts at 5 is keep it as local as possible. So let's start with the big news of today that is involving testing.
So, yesterday we said that there was no East End testing site. That changed in a day.
Yes.
The Pro Health urgent care primary care facility in Riverhead is now doing testing. The same guidelines apply. You have to have an appointment.
Okay.
You have to be already displaying coronavirus symptoms. So, and the guidance is still, if you have mild symptoms, assume you have the virus, stay home, quarantine yourself. But if you have more advanced symptoms and you really need medical care, call your physician. You can schedule an appointment with the Pro Health folks in Riverhead, and we'll get that address for you.
Yeah, I have the address and the number at the end and the website to go to. But the whole point of this is that you can drive to it.
Yes, it's a lot closer than Stony Brook. There's also one in West Babylon, but that's even farther.
Okay, but you can drive to it and you don't have to go and then sit in a waiting room infecting other people.
Right, it's still a drive-through.
Okay. How long does it take?
You know what? I'm not 100% sure how long the Riverhead facility delivers your test results.
Okay.
I do know that a Long Island company called Henry Schein, which is in Melville, has developed a 15-minute test.
Oh, fantastic.
Yes.
That's such a game changer.
It really will be, as long as it can be provided widely.
Right. We all need to know. Okay, so the next thing is, and should we do stats first or Eleanor?
Let's talk about the stuff that is uplifting to me, which is the Eleanor Whitmore Early Childhood Center announced today that their child care services for the families of essential workers is going to be free of charge now.
Amazing.
They decided as a board, as a facility, to follow what Scope is doing up Island, up the rest of the county. There hadn't been any East End child care sites until now.
Right.
It was originally going to be like $300 a week, and now here's the good news,
That's unbelievable. I was actually looking at Scope last night to see what they were doing, and it was all up Island, and I was thinking, this is awful that we don't have anything here, and now we do.
Right.
So first of all, who qualifies as essential?
There's a list that the governor has, and you could be a first responder, a healthcare worker, a home aide, a utility worker, a food handler, a bus driver for the county.
So all of those things, I assume, are on like an application that you have to go through to go.
When you apply to the Eleanor Whitmore Center, they will ask you for proof of your profession, like a work ID card or something like that.
And what are the ages?
Eleanor Whitmore Center usually has children from 18 months and up, up to pre-K. But for this particular crisis, they have obtained a state waiver so that they can have school-age children welcomed right now at the facility.
And you said how many people? You were talking about this before. Was it how many kids can they take, maybe?
I think it's between 40 and 54.
Wow. That's really great.
It depends on the social distancing guidelines and such, but I believe that they are normally equipped to have 54 children.
Right.
So it remains to be seen. Also, the other thing is that, anecdotally from some of the other child care facilities on the South Fork, like in Southampton, the Child Care Center of the Hamptons, wasn't seeing a high demand right away.
Right away.
So that might have been, the need is there, but it may not be as pronounced as maybe the folks in the state thought out here.
Okay.
Not saying that it's not needed. It's definitely needed.
Right.
But, and now it's accessible.
I mean, I was thinking about it. How could you, if you were a doctor and your husband was a doctor, what would you do? So I think that's incredible.
Yeah.
That's really, really great. Okay, stats.
So in the county, we are up about 1,000 cases in the last 24 hours. The new figure is 6,713 confirmed COVID-19 patients.
And that does have to do with having an extra, not in Riverhead, but another testing facility?
Well, the Stony Brook testing site, as well as there are folks who live in Suffolk who have been tested in Nassau.
Okay.
So there's, there's a couple of different options at this point. The county has tested 17,600 folks of various ages. Unfortunately, there were 9 new fatalities overnight.
Wow.
And all of them except one had underlying medical conditions. So this tells you that there's a really vulnerable population out there. 2 of the people who unfortunately passed away were in their 30s.
Wow.
So, that message to stay home, assume you have the virus, isolate yourself, stay away from others. It really hits home when you hear a number like that.
Right.
And so I believe that you have some of the local information.
There was some kind of discrepancy. So yesterday, East Hampton had 19. Then it changed to 22. Now it is confirmed that there are 24 people in East Hampton who officially have coronavirus.
Mm-hmm.
And Southampton's 99, Riverhead 82, and Southold 142, which has really been the biggest population on the East End to have coronavirus.
That was the first epicenter.
Right.
It's kind of shifting. The county executive, Steve Ballone, has said now on the record that there isn't a hot spot in the county anymore. It's everywhere.
Okay.
It's being transmitted in the community.
So all of this stuff about what we're doing in terms of social distancing, which some people are calling physical distancing now. And just for everybody to know also, Chrissy is a family member because she is Jason Nauer's wife. So we figured that she was allowed to come in and take over this spot for a little bit because we probably are dealing with the same bugs anyway.
Yeah.
At this point. Hopefully we are not. And we're also practicing social distancing and washing hands and wiping everything down every time anybody looks at anything. But I just wanted to assure people that we were practicing that. And to go into that, there is also, I brought this up yesterday because I was like, what is with the masks? Like you see some people wearing them, some people don't wear them. I feel almost weird if I'm not wearing one when I'm at the grocery store or something. And now I'm happy to say that there was a reason for my confusion because clearly there are different opinions about what to do from the experts.
Yes, absolutely. So the Washington Post reported today that the CDC and World Health Organizations and healthcare workers should wear the masks, of course, but in public. There are some differing opinions. They're saying that even a cloth face mask helps at this point.
So it's almost like it's better than nothing.
It's better than nothing.
Okay.
Save the surgical masks, the N95s, for the healthcare pros and first responders so that there are some, for those people who really need them.
Right.
And for other folks, I have a beautiful purple cloth mask, homemade, and, it's done wonders. And, it's really... It's really practical at this point. You go to the grocery stores, go to Citarella, everybody's got them.
I remember when I lived in New York City that I would have a huge long scarf, and that's how I would touch everything. That's how I would open a door. That's how I would, and I heard it from some Broadway star who had done that to keep herself from getting sick, so she could always perform. And I thought that's really smart. And so I think about that now when I wrap my head.
Look at Morgan taking a page from Broadway.
Right, exactly. Because it makes sense. But then I think, oh gosh, the scarf. But I think that. So people are making masks at home. You can use a scarf. I think part of the reason that there was this don't worry about masks was because so many people were hoarding them and keeping them away from the professionals. And now, so we know not to do that. So we can make our own or we can, improvise.
Right. There's lots of people sewing masks and, sharing them among the community in a positive way.
And I wanted to look into that last week, and I still couldn't find real facts about it. I kept hearing where you could sort of go, so we're still looking at that. But I think that now, if you make a mask, give them to your friends. Unless you have some kind of crazy, awesome way to make something medical grade, which I don't think you can. So keep them, and be kind to yourself.
Absolutely.
Okay. Help for businesses.
So is that April 1st?
That is April 1st, I think, yeah.
It is a small business webinar That is, the information is up on the Newsday website. And, obviously the economic impact, we can't even put a measure on it just yet.
Right.
But you have that information?
Well, I did have it, and now I can't find it in my, oh yeah, here it is. Okay. Tomorrow, April 1st at 10 a.m., Newsday and Long Island businesses are offering a free webinar on how businesses on Long Island can survive the coronavirus crisis. The guest speakers will be Erica Chase Gregory, she's the director of the Small Business Development Center, and it will be moderated by James Madore, Newsday economics writer. I'm sorry if I pronounced your name wrong, but that is, if you go to newsday.com/bizhelp, you can do that tomorrow. And I think there's going to be a lot of, I've been amazed and really impressed by the amount of websites that are up and the amount of government websites that are there that you can look at and get help from.
Yeah, and speaking of help, there's another group of folks out there who need a little extra help. People who are recovering from an addiction.
Yeah.
And so, the Express News Group on their website, 27east.com, has a feature about how Alcoholics Anonymous, AA, is helping people stay sober.
Yeah.
And it's really a challenge. And there's a hotline. It's 631-669-1124 if you need it.
And the website will be at the end is Suffolk County NY -AA.org. And this was something that Mike and I had talked about before, was that part of the process of recovery is that you are social. And this has been taken away from us. So this is so important that you can access this group, and you can go online and you can have virtual meetings, and I think that's incredible. So that's another resource. What is going on with the food? I understand that all the food pantries are being very, very, very well used. So what do we do? Do I bring food over there that I have some cans in my pantry?
There's a lot of different ways you can help.
Okay.
And right now, a lot of the food pantries have an appeal for monetary donations, but not food. This is what East Hampton Town Supervisor Peter Van Scoyoc told the East Hampton Star in the last couple of days. His quote is, "There's been a definite uptick among food pantry requests and clients given the situation. Food pantries are rising to the occasion, and we're giving them the support they need. This is a time for us all to come together." So that is what Peter had to say, and urging people to provide not specifically food items, but more the monetary support. Because sometimes what it looks like, and this is what Minerva Perez was just telling us on the perspective of OLA, Organización Latinoamericana, that it might not always look like, somebody who can stop by a food pantry and pick up a week's worth of supplies. They may be homebound. We're redefining what homebound means right now in this new era. So it might look like a Peapod delivery, a grocery store delivery service that's a little bit more expensive than going to, Stop and Shop or King Cullen or Citarella. And, you don't have that option of getting in your car and going, but it's an option that may be afforded you if the food pantries and organizations like OLA have the financial resources to do so.
Right. And that was another thing that I think that Clamshell Organization and East End Cares are doing a drive that's $5 donation. If you go to their website, clamshellfoundation.org, that will be at the end again. I keep repeating that, but I spend a lot of time preparing the slides at the end so the information is correct. But you can go there and donate $5, and that'll help all the food pantries on the South Fork. Mm-hmm. There is a real need for that. Any bright spots?
Bright spots? I mean, there's so many.
There's so many, right?
I mean, it's hard to zero in on, one specific thing. And, from my perspective at the East Hampton Star, we're seeing a lot of it all around. It's hard to even quantify because every hour I'm getting a new piece of information from somebody who wants to help and get the word out there, There
are a lot of opportunities for volunteers, and there are a lot of and things are going to change. It's going to be really interesting to see.
Yeah.
But I hope everybody stays well, stays stress-free, stays happy. And now we are also going to have an interview with Scott Howe from ARF with Angela LaGreca, and that's next.
We are very excited today to have somebody who we consider a good friend and neighbor, Scott Howe, the Executive Director of the Animal Rescue Fund of the Hamptons, which is right down the street. And, obviously this is a time I'm going to introduce you to, this is Allie. This is my teacup Yorkie, really my daughter's. And I can't imagine a time, more important time to have an animal that you can pet and love and hug. So everybody's been asking a lot of questions about their own animals and also about adopting and fostering. Tell us what's going on with ARF.
Sure. So ARF is affected like everybody. As a shelter, we are designated an essential business, but there are some restrictions to what we can do. And then ARF has its own interpretations of what's in the best interest of the animals and the staff. So with the current orders from the governor, shelters like ARF are restricted to intake only animals from New York State, which makes perfect sense under the circumstances. ARF normally brings in dogs from communities across the country and for rescue, and that needed to stop. We have, this is Abigail.
Hi, Abigail.
At the same time, Abigail has a mind of her own. I don't think
she's a cat.
She didn't sign a release for this.
Right.
But the other important part is, and I respect what the governor is trying to do, is that this is not business as usual, and we're weighing our own life-saving mission with animals, with the public well-being and the health and safety of our staff. What weighs on me every day is the safety of my staff and their families, because without them, we can't care for the 90 animals that are with us here at the shelter today. So I'm still at ARF.
You are. How many staff members are at ARF now? So you said there are 90 animals there. Tell us who's working there now. How many people are there?
The animal care staff is here, and our veterinary and medical staff are here working, but they're on alternating schedules in teams so that our veterinary staff doesn't overlap. We're trying to reduce the density of people in the building, and they're spread out throughout the building. They're wearing masks inside when they do tasks like prepare food for the animals, but most of their work throughout the day with the animals of walking, going into the catteries is solitary. Go ahead.
No, so ARF is essentially closed right now to the public, but are you still doing adoption? So it's closed. But if we take the governor's guidelines seriously, we should be staying at home, so we stopped doing adoptions this week. We just felt also right now, it's difficult. Access to veterinary care is also limited. It's limited to emergency procedures. So, our standard recommendation to a adopter would be to go take your animal to your vet, start a relationship with your vet, go through a basic wellness exam, and any follow-up vaccinations you'll need to do with your local vet. But, that's not happening right now. We know that people are yearning for some comfort. They want to, they'd love to have an animal. Maybe they've been considering it, but we honestly had to reflect and say that this isn't the right time. It's not the right time to encourage people to leave their homes and to come to ARF. And I think I have a responsibility to my staff to limit their exposure to the public as well. And we will get through this. This is temporary, but it's necessary. What if somebody is home with a lot of time on their hands and they want to foster? You've gotten a lot of calls, I understand. I spoke with Jamie at ARF. To foster, is it impossible?
We have, it's the same thing. People need to stay at home right now. Fostering involves coming to the shelter. It involves coming inside the shelter. It involves interaction with staff. Going out to getting supplies for a new animal that you're fostering. It's just, it may feel wrong in your heart, but it's the right thing. We just had to put a pause on all of that. And again, we feel it's in the best interest of the animals that are still here, that we keep our staff safe and healthy. There is going to be a great need on the other side of this. Don't get me wrong. We had an outpouring of support from fosters. We have a waiting list ready. The need is going to come from two places. It's either going to come from our local community or here in New York as the virus takes its toll on families and animals potentially are surrendered. And then it's also going to come from all the states where ARF normally receives rescue transports, Texas, South Carolina. Those communities are also on hold now. And so as soon as it's safe to do so, we have to ramp back up very, very quickly. But we also have to be prepared to help our own local community. And so we reduced the number of animals in the building. We did great adoptions. We have animals out on foster. We have a quarantine space cleaned and ready to go. But for whatever the need is going to be. And we're anticipating, again, those two scenarios I talked about, either locally, and we hope that isn't the case, but we have to be ready. It's our responsibility. But we also need to be ready for those southern states whose shelters are just exploding right now because shelters in the Northeast can't accept their animals.
So we have so many people who love ARF, who love animals. I spoke with Morgan right before this interview, and Morgan Vaughan at LTV, and she said she has a friend who's, desperate to get a dog, and so they can't call ahead right now. But there are some other shelters in Long Island that are still conducting adoptions. I understand. Is that correct? Would you advise them to go there, or is that a?
And people should be staying at home. People need to stay at home. I watch the governor every day now. I think he's doing an incredible job, politics aside. And that is the one takeaway. This is not the time.
I understand. So I know what you're saying, because people are not social distancing the way we would think they are, right? In some instances, I hear about people who are congregating on the beach. Do people take their dogs, and go on the beach? And is it okay if the dogs run together and everything? And in New York here, people went and looked at the big, emergency ship that came in, and all way too close for my liking. It's hard. It's a hard thing. But what do people who are frustrated with animals do? For the animals, or rescue cats, or rescue. They can't do anything right now, I guess.
They need to take care of themselves and stay healthy to be there ready for us on the other side. And ARF, like any nonprofit, right now, what we need is financial support. And it's a hard message. It's a hard ask to make right now when so many people are struggling and hundreds of thousands are losing their jobs weekly. But that's going to be the story of any rescue or shelter right now. And that is the need.
Yeah. I mean, you stroll to the beach and the bow wow. I covered for LTV those events this summer, and the thrift shop.
We can't plan for that. Yeah,
we don't know how that's
closed. Yeah, the thrift shop's been closed since the middle of March.
But let me ask you something. So, I mean, if somebody had, you say the financial need. So, for the average person who maybe even has lost their job but wants to do something for ARF right now, what can they do? Can they donate towels or toys, or can we drop them off?
So, again, people should stay at home. Stay at home. And if you check on other shelters, people may be sending out the different message. Ultimately, I have to make that decision for our
Right.
community, and I take it very, very seriously. I've got to protect our animals, and I have a responsibility as an organization, as a business, not to put people at risk and not to put my employees at risk, because I can't do my mission without my staff. And frankly, they're uncomfortable taking donations right now of towels and items. Everyone's just nervous. And so I want to reduce that anxiety and that stress for them, because they do have to come to work. And I know that they have families at home. And so, it would be easier if I had the type of business where I could say, all right, we're all working from home, but that's not the case. And so there's a added layer of responsibility on me. So as hard as it is for me to say no, I have to. And I have to be prepared for people to tell me I'm wrong, but I have to take this seriously, and people should know that we're going to get to the other side of this. ARF has been here for almost 50 years, and our community and our country is going to need ARF in ways like we've never imagined before on the other side.
So for somebody who wants to do something, is basically the best thing they could do right now is to stay home, right? Is that what you're saying? And then to stay healthy, and if they can, obviously, if they can support you financially, and if you've got people who have lots of money, which I know there are some heavy hitters in all organizations on the East End, big and small.
Everybody needs help right now, and it's just I don't deny it. Our FIS, but the other thing we can do is just our own social responsibility of staying home. Staying healthy. That's the way you can help us all. And we'll be on the other side of this. And there will be animals that are going to need you. I look forward to when we can start sending animals out on foster, and we can start helping other shelters that are going to be hard hit by this down the line.
I appreciate you being here with us at LTV. We support everything that you guys are doing, and we can't wait till the day when we can come back and say that ARF is open. Is there anything else you want to say to the community out there who love animals and who are supportive of what you guys do?
Just stay with us. We're trying to put out good stories on social media to let you know how we're taking care of our orphans. And we'll keep you posted as opportunities for fosters and adoptions take place. We're still accepting applications online for adoptions, that we're not going through with them right now. So, all of that's still up on our website, arfhamptons.org. And just know that as soon as possible, we're going to be back up and running, and there are going to be thousands of animals who are going to need us in the future. So stay with us.
Thank you. And thanks for wearing headphones that match my 1980s daughter's headphones. Thank you. I mean, I thought it was just me, but all right. Thanks again. Scott Howe, Executive Director
Thanks
at
a
ARF.
lot.